You have to mute yourself. You have joined. Please mute your live. You mute your Zoom. Mute your Zoom. You are in video. Can you mute your Zoom? Cannot hear me. Hear me on the IG. My face. Oh, hi. Okay, I think we have one person watching this video at the moment. Okay, I don't see you. You have joined, but I don't see you. I don't see you and I can't hear you. Okay, it's working now. Finally, can you hear me?
Yes.
Oh my god, what a pain. I hate IG. Okay, so welcome to Ask Us Anything. This is the second time we are doing this, and we are from a new company called Underneath the Moon. But I have been in practice for coming to 15 years, and Krish has also been in practice for a very long time. So I will get Krish to introduce himself.
Hi, my name is Krish Phua. I'm a registered counselor with Singapore Association for Counseling. I'm also a certified clinical supervisor, and I do teach. I'm a lecturer and also a consultant for counseling and psychological subjects. And I'm very happy to be here. Thank you, Dr. Mata, to inviting me to have this live show together with you. And it's Ask Us Anything. We do receive certain kind of questions, and then we will like to share with you. And back to myself, I specialize in trauma, PTSD, addictions, gender and sexuality, couples, as well as family therapy. Thank you very much.
That's great. So you talk about you specialize PTSD, trauma. Can you tell us the difference with all these?
Okay, trauma could happen to anybody, I should say, since childhood until growing years or even adulthood. It could be caused by certain kind of accidents, incidents, or long-term abuse, or abuse could be physical, sexual, verbal, or psychological, emotional. All these are the trauma that we counted. Trauma is something that you feel very uncomfortable. You have fears, you have nightmare, you have flashback, all these kind of things. So that is considered trauma. On the other hand, PTSD is something is the after a trauma happened to you, what will happen to you? You may have certain kind of stress, anxiety, depression. These are the things that we are looking at. Yeah, PTSD stands for post-traumatic stress disorder.
Okay, so what I'm hearing from you is trauma is something that happens, and PTSD is the effects.
Yes, correct. That's right.
I learned something new today.
You're always very smart.
No, seriously. Okay, so tell us more before we go into the questions. Tell us more why you decided to specialize in sexuality.
I always feel that sexuality is always a very significant part of human beings. Yeah. But a lot of time we are always feel that it's a taboo, it's something that shy to ask, not dare to ask, something like that, especially in Asians, in as an Asians and also in Asia country. Yeah. But even Singaporean, I must say that Singaporean is such a cosmopolitan, such a melting pot, yeah, internationally, but somehow we have still this kind of reservation, hesitation to talk about sexuality. I think it's something that we need to talk about it. Yeah, not it's a very important part, element, component in our life. But throughout the whole year, since maybe when we started to have puberty until the day we die, but we don't talk about it. We find it very taboo thing, shy thing. I don't like that kind of attitude. I think we should talk about it. We should celebrate. I am a person who look into sexual sex positivity, where we do talk about it, celebrate sex, and then as long you don't hurt yourself, hurt others, I think we are okay with each other on that. I think that is very important criteria we are looking at. Yeah.
Yes. And one of the counseling ethos, of course, is do no harm. And
Yes.
I think, I learned so much about being human because of all my counseling training. But I also think this is something that I started to embrace outside of being a counselor. Um, okay, so I do want to say this is Ask Anything in case you are just joining us. And this is an initiative underneath the moon. It's a new counseling company. We are focusing on sexuality and relationships. That's our specialization. But we can do so much more, as you can hear from what Krish is sharing about his background. So just to share a little bit, because we actually talk about in our publicity how we have our other colleague, Shaza, not able to join us today because it's in the hospital. So still stable. We wish her well, but we decided to continue with Krish. Okay, so the first question is, as a 25-year-old man, I'm concerned about my penis size affecting my confidence in bed. So how can I overcome this insecurity and improve my sexual confidence?
Okay, very good question and a very common question I always get from my clients, male clients. Yeah, those clients with a penis. Okay, I think the very first thing we need to know that educate yourself in the sense that I want you to know size doesn't matter. Yeah, size doesn't matter. I think when you are having sex or making love with your partners, the most important thing is the emotional connection as well as the sexual techniques over the size. Okay, I also encourage you to have a very open and honest communication with your partner and then show your concern and then see what is the response from your partner. And then maybe the response is quite positive, it will boost up your confidence in your performance in the bedroom. Yeah. And then focus on your overall sexual skills as well, in the sense that you can use other part of your body, not only that part, okay, to satisfy yourself or satisfy your partner. And then also the sex position is something for you to look into as well. So that needs a lot of practice and also a lot of communication among your between your partners. I also encourage you to uh, build up your stamina. Build up your stamina through regular sports, regular exercises. Make sure you have very good fitness and then confidence in other parts of your body, like for example your muscles or whatever. That will make you very good, I should say. And then, of course, don't forget about your self-esteem as well. Yeah, outside the bedroom, maybe you can engage certain kind of activities that will make you feel good. For example, volunteerism, helping other people. That will give you a lot of credit to yourself, and those you can feel that you are accomplished of something. And then the next one, I must say that maybe is a mindfulness and relaxation. Make sure you are very relaxed when you are in the bedroom and also very mindful. Understand what's going on, understand your sensation, what you're looking at. with this kind of mindfulness, you are very present in the process of having certain kind of intimacy with your partner. That will enhance your focus, and then also you'll improve your performance and satisfaction as well. And of course, lastly, is that maybe talk to me, talk to Dr. Mata or our colleagues, okay, on certain kind of techniques or certain kind of issue that you have. It could be psychological issue, it could be image issue, or it could be other skills issue or knowledge, something that we can look into, and then we can work together. Yeah.
I really like what you're saying, because there's a saying, it's not what you have, it's what you do with what you have.
Yeah,
So
that's right.
I really like what you are also saying about work on yourself, build your self-confidence, your muscle, and what is inside you as well. Because sex is sex, but you are not just choosing a partner based on sex. You are choosing something more substantial, more longer term, like who the person is and how you feel when you're with the person. I think these are the things that are more important. In fact, the people that I married didn't give me good sex. So, but I chose them because we had a soul connection, and the feeling was amazing when we are together, the compatibility. So I have to be honest, well, both of them didn't give good sex, but actually it wasn't because of the organ even. So I think sometimes we focus on things that are not even important to your partner. You think it's important, but does your partner think it's important? So this is why what you said, communication is very important. Okay,
Exactly.
we go to the next question. My
Mm.
partner and I are exploring BDSM, specifically impact play and bondage. Can you offer safety tips and advice for beginners?
As I mentioned, I'm a person believe in sex positivity, so BDSM or whatever doesn't matter to me, in the sense that it's not something a taboo, something shy to talk about. I just want to have a request in the sense that the safety and the consensual, these two elements are very, very important in BDSM. Yeah, so make sure you do. Again, communication is very important. You have a thorough discussion with your partner who are willing to do BDSM with you. Yeah, so make sure you guys talk about what is the interest, what kind of BDSM you want to do. Yeah, together, and then what is the boundaries, and then what is the limitation as well. Yeah, as I mentioned, consent is very important. This activity must need 2% consent or more if you are doing in a group manner. Yeah, up to you, but consensual, safety are very important. I think the first thing you can do is that you can watch some video tutorials or some workshops, attend some workshops, or even some books to understand what is BDSM about. There are many, many types of them, and they are in a very wide spectrum. So understand what is the techniques, what is the safety measure you need to watch out. That's very important. And then if you are very new in this BDSM, start slowly. Maybe have light activity first, and then gradually increase in terms of frequency, duration, as well as intensity, and make sure both of you feel comfortable with each other, and then you're able to experience it much more better. Yeah, that's very important. Sometimes BDSM use of tools. Okay, make sure the tools are very safe, body-friendly materials. Okay, doesn't make your skin uncomfortable, and then avoid those tools that may be cause some unintended harm along the process. Yeah, make sure. Yeah, another one, if you are using tools or toys or whatever, make sure you always clean them, wash them, and then because otherwise it may have a certain kind of infections. Yeah, it will transmit some infection between the two parties or more. Check circulation. Okay, your blood circulation, your breathing circulation, also the air ventilation in the room. Okay, make sure it's always safe. Yeah. Okay, talk about safety. Very important thing is that always practice safe words or signals or both. Yeah, like for example, you can shout red when you want the other party to stop. Okay, and then yellow maybe is to slow down. Okay, green means please proceed further or whatever. Okay, and because BDSM, some of them you need to tight the other person or you to be tight. So, but make sure you are not blocking your mouth to say some verbal expressions. Maybe you have at least one gesture on your hand that you can make a stop or something like that. That is a code there between you and your partner to know. As I cannot stress more enough, safety is very important. Yeah. So what are the things? Okay. Another safety is that emergency. In case something happen, some tools like a pair of scissors or whatever can help you to get you out from the danger that you are facing. Yeah, that's very important. And the last one, I must say that after the session, maybe have some aftercare, some debrief together with your partner or partners. Yeah, talk about what do you enjoy, what do you do not enjoy, and then comforting each other if certain kind of some hurts or something happen, and then also look into what the things that you can do better together, enjoy together, and then so that you can improve the intimacy connection between you and your partner or partners. Yeah.
Wow, that's a lot, but very comprehensive. Thank you.
Thank you.
I think it's very important what you said, that people need to educate themselves and people need to be good communicators. And being a good communicator doesn't come naturally to all of us. We actually need to learn to be good communicators. So along the way, we may make so-called mistakes. We may accidentally do things that offend, hurt our partner. So it's really important to know how to repair the damage.
Yeah.
So the ability of saying sorry, the ability to learn and to not make the same supposed mistake again. Because actually there are no mistakes. Because a lot of times we actually learn through our mistakes. So it's really important to look for someone who's trained to be your guide or supervisor, attend workshops, and make sure these people are willing and able to show you their credentials. Not just say, oh, I've been doing for 10 years. Yeah, you do for 10 years, but what does it mean, you know? Just because you've been doing something for 10 years, maybe you're doing the same wrong way for 10 years, it doesn't mean anything. So what kind of workshops, what kind of supervision, what kind of continuing education are you doing? So be very, very wary of people who give you very vague answers, because honestly, a lot of people who are in the lifestyle in BDSM, they call themselves being in the lifestyle, are some of the worst educators I've seen. Because they are so into it, right? So they really, really like something, but it doesn't mean they know how to teach. So the ability to teach is another skill. So I have run workshops with people who are in the lifestyle, and they make everything so confusing and so laborious that the audience become even more confused. But actually, they are just not good educators. Just because you like something doesn't mean you are good at it.
Yeah.
So make sure you go to people who can really, really help you. And in this day and age, there are so many different kinds of resources. So I was wondering, I don't know whether I'm putting you on the spot. Are there certain resources that you found was useful
Me?
in the area of BDSM?
I must say that sex is not only one-dimensional. It's not only for procreation or something like. It's for pleasure. It's for fun. It's to express your love. Also, something it can be a play as well. It's an adult play. So it's something you can explore really. But as I say, a lot of activity, sexual activity, is a spectrum. It depends on how much you want to do it, how serious you want to go into. So it depends on your capacity, your appetite, and your capability as well. I think BDSM is something that it's not something a bad thing, I should say. But as I mentioned, two things: consensual and also safety. These two. Yeah.
Okay. Let's go to the next question. So I'm in my 60s and experiencing vaginal dryness. So this is someone with a vagina, leading to discomfort and tearing during intercourse. What are the best lubricant options for me, and is hormonal therapy safe at my age, 60?
Okay. This question is about vagina dryness. Okay, which is a very common phenomenon. condition for people who are experiencing people with vagina, of course, experiencing menopause or even after menopause. I think this is something very common. Straight away, the things that if you are looking for certain kind of counter solution is very easy, is to use lubricant as you suggested in the questions. Yeah, but I would like to you to know that in the market, okay, there are some lubricants. It could be water based, it could be silicone based, as well as a hybrid. Both of them put it together. So it's something that for you to consider. So that although you're during the menopause process or during after the menopause process, the estrogen, the female hormones level went down, causing the dryness in your vagina for intercourse or whatever. That is very normal. But lubricants is a very good solution. But make sure you check with your pharmacist or family doctor. Should you use a water-based one, silicone-based, or hybrid? Up to you. Yeah. I also know that you can also use other things to help to supplement, to complement, which is called vaginal soaps, cleansers, washers, or moisturizers. Okay, this will help you to make your the vaginal portion easier, more hydrated, I should say, maintain certain kind of hydrations. Okay, for you to increase the elasticity of the vaginal tissues as well. Okay, so again, consult your pharmacist or family doctor on that. That's very important. What other things we can do is that I really want you not to stop regular sexual activity, not because you feel uncomfortable, you stop it. Because we need to continuously educate our body system that you regularly have this sexual activity so that the body knew that the part is still be useful, and then they will not stopping in terms of functioning. And then this will help them to continue with the blood flow as well as the maintain the vaginal health. That's very important. Yeah, even this sexual activity may not be so-called penetrative related. Yeah, hydration and dietary is another thing for you to look into. Drink a lot of water, and then make sure you can choose omega-3 fatty acids that will help into your body system, especially the part. Consultation, of course, you can consult with your family doctors. Is there any new treatment, any particular cater to your particular needs, your personalized needs? I think that's very important as long as they are safe and appropriate for you. The last one, you may want to consider hormone therapy. There's this so-called low-dose vaginal estrogen therapy, which hospitals are doing, but it could become in the different forms. For example, it could be on creams, could be tablets, or even ring. But I would like you to pay attention to the side effects and what is the cost about, what is the benefits about for you to make the evaluation. I think these are the things that I can think of right now. Yeah.
Yes, thank you. It's very, very comprehensive answer again. So I want to say, if you are thinking of hormonal replacement therapy and your practitioner, your doctor is giving you all these options, okay, make sure you feel very comfortable with it because you are the one living with your decisions. If you feel that the doctor and you is like not having a good rapport, you can always go for another consult to get a second or third opinion. This is your health. But I think a lot of people are very worried about hormonal replacement therapy leading to cancer. I want you to know that I have been to many medical conferences, and they keep talking about how the advancement of medical science. So I don't want to say, I don't want to put my head on the line and say it's not going to hurt you, because I am not a medical doctor. We are not medical doctors. So it's really important that you realize the knowledge, the fear that we have is been around for 10, 20 years. Is this really still valid? And really ask better questions, get better answers. If you are very, very uncomfortable to go for hormonal replacement therapy, you can consider to go for TCM. You can consider to go for other therapies that you believe in. Because I do know of people, they refuse to go on hormonal replacement therapy. They go on TCM instead, and they actually said it helped them with a lot of relief. So TCM, traditional Chinese medicine, is maybe more compatible with our Asian body. So whatever decision that you make, please go and do your own research. We can only give you answer in general. So you have to also consider the fact that when it comes to the estrogen implants that supplements that Krish is talking about, it is something that may really be necessary. So don't just use the over-the-counter products that we talk about, lubricants, soaps, all this and that. I think they will help with the moisture, but all this estrogen actually is more, and it will help you with your mental well-being also. So people who need it lah. You know, you also need to look at your quality of life. So don't avoid these things, okay? Go and get the proper consult.
Yep, absolutely, absolutely. So if you are able to get a therapist to talk about all these things, then you are able to know what are the options presented to you, what are the choices, what are the things that you can do, so that from there you can make a decision that cater to your personalized needs. I think individualism, customization is very important in terms of looking into a therapy to get yourself better in terms of wellness, welfare, as well as your well-being. Yeah.
Yes. Thank you, Krish. Okay, so just want to do a shout out again. So we are from Underneath the Moon. That's underneaththemoon.com, and you can actually book a session with Krish or Shaza, who is not here today because she's in the hospital. So yeah, go and check out our website underneaththemoon.com. So the next question is: I recently had a miscarriage and it's affecting my desire for sex due to the emotional, pain and fear. So how can me and my partner, how can my partner and I support each other through this difficult time?
I must say that first of all, I feel very, very sorry for the things that you encountered recently. Very sorry. I hope you can recover very well in terms of physical, emotional, as well as psychological. Yeah. I also want you to know that you are not alone in terms of having this kind of experiences. Maybe your partner, your husband, or whoever, your boyfriend, may be going through the same pain emotionally, psychologically as you. Yeah. So that's why I want to address this question for both of you, not only for you. I want to consider the other party as well. Yeah. I think the first one is that have very thorough, open, honest communication between both of you, and then tell each other your feelings, your fears, and your needs. And then both parties should be able to get themselves heard and also being supported. Yeah, at this difficult journey, transition period, both of you need each other to help each other. I think that's very important. That's the first suggestion I would like to make. And also, don't forget about self-care. Okay. I believe you go through a lot of stress, a lot of mental health issues, something like that. Maybe it's good for you to distract yourself, get yourself feel better, like through certain kind of exercise, hobbies, or even relaxation techniques that will help you to feel better. That is under self-care. But don't forget your physical needs as well. Okay. Uh, During the miscarriage, certain part of your body could have been not doing very well or functioning very well. So make sure there is this kind of physical effects on your miscarriage can be healed. Yeah. So do have a medical checkup, and then get what are the assurance from your doctors, family doctors, or your gynae about that, and then try to look into that. Yeah. Get yourself healed physically. As for your emotional needs, okay, maybe you need to seek professional help. Look for a therapy who can process your grief, your loss, and also who are able to talk about reproductive health with you. And then I believe couple therapies is very important at this juncture of time and also this experience. And of course, you can read some books, articles, or some video to understand what is it about, and then how the things can make an impact, and you what are the experiences you may go through, so that you are able to mentally prepare yourself better. Yeah. And then I believe the sexual activity between you and your loved one still need to carry on, but I would like you to start it very slow, okay? Get your time to heal, okay? Take your time to heal, and then no rush on resuming any sexual activities, okay? Take your own pace, yeah? And then the emotional part, rebuild the emotional connection between you and your partner are very important. Maybe no non-sexual kind of activities like cuddling, talking, and then spending quality time, hugging, kissing are very important so that you can do that. Do not rush into the penetrative kind of sex at all. Yeah, take your time. Yeah, when you are ready, then you are ready. And then it's good to you to create a safe space, and then so that both of you feel comfortable, and then avoid any pressure or whatever. Be patient with each other. I would suggest both of you just have a very short trip out overseas or whatever, and then rebuild the connection emotionally first. Yeah, and then maybe slowly on the intimacy sexually. Thank you. Yeah.
Thank you. Yeah, I think very good answer. I think there's also support group. So you might be thinking like support group. There's also support group for the couples. There's also support group for same sex because the woman is the one carrying the child, fetus. And so what happens is it's hard for your partner to understand what you're really feeling. And because in your pain, you might start to say certain dismissive things like, "How will you know how I'm feeling?" Right? Because they don't have a womb. So be very mindful of this kind of comments. It can really be very devastating. Also, the way you express yourself, the way you grieve, is probably not going to be the way your partner grieve. So I know of clients who they have the grief and then they have the other things about the way their partner didn't support them. So instead of this incident making you all become further, make sure the incident is bringing you all closer. So by leaning towards each other and also having compassion for each other's differences because they grieve in a different way. Maybe you need to keep talking and then maybe they just keep very quiet. So they keep very quiet, then you think they don't care. Okay, so don't go and make up all these additional stories that doesn't serve you. I think is what I'm trying to say because opposites attract generally, and what happens is you will often be with somebody who's quite different from you. And there's nothing wrong with that. It's just the values needs to be similar, but the differences is actually very, very common. So basically don't let it become an even bigger issue.
Yeah, be more
Uh,
understanding. Yeah, be more understanding. The person who were pregnant and then somehow lost a part of herself is not an easy journey for herself. So be understanding if you are the partner of her. Yeah, thank you.
yeah, as you can imagine, it's like what you said. It was inside her, so it's not easy. Okay, we
Yeah.
are having different varied questions, by the way, varied questions. The questions are touching on different aspects of sexuality. So we didn't just want to keep answering the same kind of questions. We were very selective, the kind of questions. So this session is really a little bit of different topics. And so the next question is maybe not so common in the Asian context, but you'll be surprised. I actually have several clients especially after COVID, asking questions about opening up their relationship. So a question is, my girlfriend and I are discussing opening up our relationship, but I'm worried about feelings of jealousy and insecurity, especially if she starts seeing someone else romantically. So how can we navigate this?
This is a very it's getting more and more common. I should say, open relationship, may it be heterosexual or homosexual or even
Okay.
lesbian or whatever. But yeah, in LGBTQ plus IA, it's getting more and more. It doesn't matter. It's only limited to heterosexual. So I would like to answer this question more generally. But before that, I want to say again, I'm not making any comments or whatever negatively. As I say, I'm a positive person. So it's up to you. I only have two conditions. As long you don't hurt yourself, as long you don't hurt others. Okay? It means if you really want to have this kind of open relationship, two parties must have the consensual. They must have the agreement with each other. Yeah. But before that, I also you can do it during very honest, open communication on the things that you are looking at. You can set the boundaries, the limitations, what is the trust issue that we can have together, the kind of thing. So carefully navigate into these directions. Yeah, this is something that I would like you to look into. And then you can also talk about your fears and your any concern. Like for example, just now you mentioned about jealousy or even security, insecurity. So all these things must be talked about. Yeah, so that each other understand each other better, and then see what are the things that they can do together. I think, yeah. Let me see. Okay, so as I mentioned, consensual from both parties is a must. Okay, as long as one party say no, this thing, this deal, this arrangement is to be stopped. Okay, that's the emotional, that's very a criteria. Again, do your desktop research first. What are the educational resources you can reach out to, like books, articles, video about consensual non-monogamy? Yeah, look into that. What is the effect? What is the advantages and disadvantages? All these kind of things. Yeah. Number two is to be patient and be flexible, because you are looking into opening up a relationship. It is a process by itself. Yeah, it requires certain kind of time, some flexibility here and there, and also the mutual support and respect as well. Yeah, so be careful on that. And if you really feel that easily jealousy or whatever, I would like you to really build up your self-esteem, yeah, your self-worth. Yeah, maybe you need to have engage some activities, just like I mentioned, volunteerism, that you make you feel very confident and fulfilled in your life. Yeah, so that you know what's going on. And then your jealousy management is something that is I want to say that that is very normal, and to me it's a good sign, in the sense that you still care about the other party, in the sense that you still find this person is very significant to you, in the sense that romantically or physically, psychologically, or even sexually. Yeah, so that is a good sign if you feel jealous of something, yeah, with your partner. But I would like you to have very honest communication to let the other person know, and then do some self-reflection as well, so that you have certain kind of reassurance from your partner and for yourself, yeah, from yourself. Okay. If you really want to have this open relationship, it's good for you to establish rules. What are the rules? What are the guidelines for you to engage in this activity? For example, who are the person we could see? Yeah, who are the person we could see, and then how often, and then what kind of activities, and then which location can you bring the person home with your present or without your present, that kind of thing. Talk about it. I know it's not easy, but I would like you to talk about it so that you can manage the expectation of each other. Yeah, and then along the way, please do regular checkup, talk with each other, see what's the feeling about, what are the, and then along the way, if you feel uncomfortable or whatever, insecure, jealous or whatever, talk about, reassess the boundaries again. Yeah, always, as I mentioned, this is a process. This is a process. And then if you really need help, okay, to have someone to come into the picture to intervene the relationship, a therapist like us will be a good one, in the sense that we are able to give you some suggestions, some strategies to look into things, what are the things that you can make you both feel better, and then whatever you are cannot be talked to each other directly, maybe through us or whatever, that is something that we need to consider as well. And then yeah, open relationship, the ideal one is that both of them feel happier, and then they are more committed to each other. Yeah, otherwise it will be something that for you to reconsider again in the future. Thank you.
Yeah, I agree with everything that you are saying, but I like the first thing that you said the most, which is if either party is not comfortable, then the deal is off. I think
Yes.
a lot of people, once it's on, they do not know how to turn it off. Meaning, is your partner more important, or is you having fun more important? You know? So the thing is, it should actually proceed at the pace of the person who is supposedly slower. So just go very, very, very slow. So some ways you can potentially open up in a very small way. Um, maybe give an example. Like if you feel very jealous, somebody giving your partner a hand job or blow job. So maybe you can hire somebody to give your partner a massage first and see how it feels like to have somebody who is paid just giving your partner a massage, nothing kinky, just massage, and you see how you feel about it. Maybe because it's paid, so you will feel less triggered because it's a paid relationship and there's no romance, there's no sex. So what if this person was a sex worker giving your partner a hand job, blow job? Would that make a difference? Or would it make a difference if the person is attractive? Would it make the person if the person is younger than you or older than you or more pretty than you? And all the things that may trigger you may be things that for you to reflect, like why is this triggering my sense of self-worth or identity? Is everything about a value of a person based on how they look or the fact that people are younger? That means I'm going to be thrown away because they are younger. So does younger mean more attractive? So by questioning all these things, you will actually be able to treat this a little bit like an exercise to better understand yourself also. So don't just think of like wanting to keep your partner safe or keep your heart safe or control the situation, control. So also the other way of people thinking about opening up the relationship is we choose to be together, right? We choose to be together, but we are not here to own someone and you're not here to control someone. It's just like when someone has a child, their child grow up to have their independent mind and independent life. So you love the person and you want, let's say, the child to be happy. So maybe you may not agree with everything the child wants, the things the child likes, but you still choose to love the child. So using that analogy, so think of it like a partner. Your partner is not a child, but just think of your partner in the same way. Like you love the person, but you don't own the person. The person has independent thoughts and feelings, and what the person likes to try may be something very different from who you are. So not necessarily that person is better. It's just maybe they just want something different. That's all. And it's impossible for me to have straight long hair and to also have short hair at the same time. That is impossible. I cannot have black hair and be blonde at the same time. It's just not possible. You cannot be single and married at the same time. It's just not possible. So in life, we make choices, and sometimes we just admire what we don't have. Anyway, I think I've gone on for too long. So remember, we are from Underneath the Moon, and you can actually book a free 15-minute session with Krish or Shaza. Our company actually specialize in supporting people around sex and relationships. So the next question, I want to give a bit of a trigger alert, a trigger warning. So the next question has to do with somebody who is a survivor of sexual assault and didn't share more about what the nature of this sexual assault is. But as a survivor of sexual assault, I struggle with intimacy, especially when my partner initiates physical contact. So how can we work through this together?
This is a very serious question and also difficult question, I must say. I want to say sorry to the person who encountered this sexual assault. Again, sexual assault could be a spectrum, a wide spectrum. It could be from molest or until to a very serious case. Since the question did not indicate what is it about, I don't want to talk about it as well. I just want to make it generally my answer. So first of all, say sorry. I'm sorry about the situations, and I want to talk about that. Just like the miscarriage, okay, it's not only yourself, okay. I don't know this thing, sexual assault happened before you meet your partner or after. So if it's after, I believe he or she also encounters certain kind of emotional disturbances as well. So that's why I want to open up the question in the sense that I want to address both emotional requests, emotional needs of both of you, and I would like both of you to work together to encounter, to transfer, to transit over this difficult period together. I think that's very important. Yeah. So I think again, I cannot help to say that communication between both of you is still very, very important. Talk about your feelings deeply, your boundaries, and what are the things that really trigger you, okay, as a victim and also a partner of a victim. So that is very important for both of you to make sure you guys can talk about it and feel safe. And then what are the triggering things will make you feel very uncomfortable? Talk about that. Yeah, talk about that. And then educate your partner as well, in the sense that what are the impact of sexual assault on you? How does it impact you? How does it make you feel uncomfortable? So that both of you are able to understand each other better, and then hopefully your partner can give you a lot of empathy and a lot of compassion as well as support, which you really need from him or her. Yeah. And then be patient and compassion. Yeah. Both of you need to practice patience, and then take things slowly. Don't need to rush anything, because this process will take some time. Yeah, you need to get yourself to recover individually before you can restore the relationship and also improve the relationship. I'm talking about 3 layers of recovery right now. Yeah, yourself, and then to restore, and then the last one is to improve. There's 3 stages. Yeah. Uh, uh, Safe environment. I suddenly think of safe environment is very important. If you really want to have certain kind of intimacy, restore the relationship, sexual relationship with your partner, make sure you feel safe and comfortable. Yeah. So quite a few things you can do is, like, for example, physical setup. Make sure, like, using soft lighting, some music, some ensure privacy, that you feel safe. Yeah. And that will make you feel more comfortable. And then another one I can see that is the consent and control, in the sense that I want you to gain 100% of control over your body. Yeah, when you want it, when you don't want it, how much you want it, and how deep you want it, something like that. You always have the 100% control, and then your partner need to respect whatever decision, whatever direction you want to go. That is very important. Maybe again, you can establish a system between a code or whatever, a gesture that you can let your partner know, okay, when to stop. Like red, you have sharp red, that means he needs to stop or she needs to stop for you. Yellow, slow down. Green, more, continue, something like that between both of you. Again, make sure you have verbal expression or gesture expression to let the other party know about your direction, your willingness. Yeah, all these are very important. After a sexual assault, want to rebuild certain kind of intimacy, sexual intimacy with your partner, needs some time. I would like you to do it very slowly. Graduate intimacy is to build out the confidence in yourself, and then you maybe want to start with non-sexual touch first, like, for example, holding hands, hugging, cuddling. All these are very important. And then as long you feel more comfortable, the other party and yourself can do slightly more and more. Take your time. Yeah. Another thing I can think of will be the mindfulness and relaxation. So in your bedroom, try yourself to be very relaxed, having certain kind of relaxation techniques for you to do practice, so that you can ease your mind, ease your stress, and then you are able to focus, so that you are more present in every single move in the bedroom with your partner. Yeah. So mindfulness, relaxation is very important. Yeah. So that your anxiety, stress level could be reduced, and always stay present with yourself and to your partner as well. The last one is, of course, look for people like us who are able to address your anxiety, your stress, your trauma, especially PTSD together, and then also can share with you certain kind of strategies or technique for you to manipulate or for you to use, and for you to maybe we can expand to the couple therapy as well, so that both of you are able to focus to each other and then understand each other better, how to communicate, how to understand, and then the empathy, compassion, everything will come into the place. Yeah.
Yeah. So just now, as you were sharing about all those things, as you're going through the recovery from sexual assault, Of course, it's not a one-step thing. There's many things. It's not a linear process, meaning it's not straightforward. It's not a straight path. Then actually I see the the link with BDSM. So all the things that we mentioned just now relating to BDSM also applies in this situation. So
Yeah.
you can actually watch our previous answer. Safe words, verbal, non-verbal, consent, boundaries, creating a container, taking one step at a time, resources, going for classes. All these things help. And what I find a lot of times, I mean, it should be obvious, but I still want to say the obvious. The clients who experience sexual assault with their partners coming with them, they already have supportive partners. If their partner is not supportive, then it's going to be even more challenging. So you may find yourself in a situation where your partner is not sensitive to sexual assault and the symptoms and what you need. So don't be the person, like you are going through your own stuff and then you feel like you also have to educate your partner. This is very, very difficult because your partner is possibly sexually frustrated and feels that you don't love them enough. So it's really important to actually go for therapies because then we will facilitate things that maybe you also don't know what to bring up and you are not an educator. You do not know how to educate your partner. Whereas for us, we have seen many, many cases. So in a way, it's a bit like, let us be the bad guy. Let us be the one to broach this sensitive subject. Let us be the one to bring out the questions. Let us be the one to mediate the situation and to give suggestions for exercises that you all both feel comfortable to do. So we are not here to tell you what to do. We are here to guide you, to support you, and the autonomy, the choice to decide what to do still is yours. So I think if you have a counselor that is very forceful and forcing you to do things, it's not going to work. So know that it is a symbiotic relationship. It's a dual relationship. I mean, it's not a dual. It's a relationship where we are working together, therapeutic alliance. So this is the benefit of going to practitioners who actually really, really specialize in this because we actually eat, live, breathe sex for a living. We really, really know what we are talking about. And it is very different from going to a generic counselor who maybe just want you to talk about your anxiety again and again, or maybe want you to work on your communication again and again. Not to say it's not valid, but sometimes if you have a very specific issue, you need to go to people who specialize in it. So this is why I feel you hopefully you can see what we are doing and what we are bringing to the table in terms of supporting your relationship. Actually, sexual assault is very, very, very common, very common. And I even have heard of several clients who said they were raped, but they didn't know at that point that they were raped. Because the idea of rape is so much what we see in the movies, and we think it's supposed to be painful, there's supposed to be the blood, it's going to be gory, there's going to be screaming and things like that. Okay, so yeah, so I already given the trigger warning just now. So just know that we are not here to judge, and there's no shame in reaching out for support. In fact, it is the people who are strong who get support and then get better. But you don't want to be in a situation where you feel that you are stuck. Okay, so by actually asking for help, you are actually being the brave one. You are actually being the strong one. So we still have 8 more minutes. But I actually want to ask this last question, Krish,
Yeah.
last question, because
Yeah.
I'm very, very sure a lot of people actually always ask this.
Yeah.
Okay, so the last question is, my husband, age 45, has difficulty maintaining an erection during sex. What are the common causes of erectile dysfunction and what steps can we take to address it together?
Okay, let me see. I think I saw the question before.
Let me put it in the chat.
Yeah.
Okay, so we also have Zoom going on at the moment, so that Krish and I can message each other.
Okay. Erectile dysfunction is a very, very common issue. Typically, individual with penises having, especially from middle age onwards. Yeah, but it doesn't mean that young people cannot have it. It does happen as well. So that's why I want to answer this question again generally. Yeah. I would like to see a few things. Again, ED, erectile dysfunction, has two components, big components. One component is on physical, the other component is on psychological. I think these are the two components we're looking at. Let's look into the physical one first. Yeah, physical, to me, the first thing I will consider is the lifestyles. Does your husband smoke heavily, consume a lot of alcohol? Does he exercise himself regularly? So because all these factors, lifestyle can affect the functions of his organ. Yeah, so that we need to look into that. The other one is a medication. Yeah, some people, they have to take medication due to the hypertension, depression, anxiety, or other things. That may be causing certain kind of side effect on his function of his organ. Yeah, so that's something we need to look into. The third one I can see that is the physical factors. Okay, it could be the heart disease or diabetics or high blood pressures or obesity, any hormonal imbalances that affect the flow of the blood into the organ as well. That may again affect the functionality level of the penis. Yeah, so this is something that we need to look into. And also another one, it could be due to certain kind of external force or damage or accidents through accident, all these things. So all this we need to be careful on that and then see what is going on. Yeah, the last one, the second component will be psychological issue. Yeah, psychological issue could be the relationship between both of you. Yeah, I do not know what happened, so that is something we need to look into. And then maybe your husband went through certain kind of stress, anxiety, depression due to work, due to lifestyle, whatever. Then we do not know. Yep. So these are the two components. Please make sure physical as well as psychological. So as been how to what are the options you can look into is that the first one, of course, see a doctor first. Yeah, see a doctor to have a medical consultation to rule out any physical issues, medical related issue, have a thorough evaluation and diagnosis, and then see what are the things causing that. Okay, it could be you may want to do blood tests or physical examination and other maybe diagnostical measures. Okay, to understand, to rule out things first. Yeah, and then just like I talk about lifestyle. So see, is there any way for him to, if he does smoke, cut down the smoking or even quit a lot of consumption of alcohol, maybe reduce it or even cut it down totally, resume regular exercises, have a very balanced diet tree, and then these are the things you can do. Yeah, and then communication. Yeah, assure him. Okay, this kind of sexual needs or concern or expectation, let him talk about it. Let him talk about his concern so that you are able to actively listening. Do not judge so much. Okay, and then that will help him to reduce his anxiety and also his guilt or shame or whatever in front of you. That also can improve the intimacy, connect, intimacy and also emotional connection between both of you. That is very important. In the market, I know there's some called medical devices like vacuum erection devices that they can explore. Yeah, he can explore for himself. And then again, medication consult. The doctor maybe can use certain like Viagra or Cialis or Levitra to explore. But again, my caution is that make sure his health condition is able to take it, and then because there are some prerequisite condition for this consumption of the medication, because they do have certain kind of side effects. Yeah, be careful on that. What other things? Yeah, some people, just now we talk about TCM, some people they sought for acupunctures or any supplements. That is something for you to consider as well. And then, but again, be caution, yeah, in the sense that are you suitable, your body types, your body conditions able to take it or not. So make sure you are under supervision before you do this kind of alternative treatments. Yeah, and then again, the last one, of course, is us. Yeah, we were here to conduct couple therapies or even individual therapy to look into the romantic relationship between you and your husband, as well as his individual situation, mental as well as psychological needs. For example, he may go through certain kind of stress or depressions or whatever, or even romantic relationship between you and both of you or something like that. So it's something for us to look into. During the process, we are able to uncover a lot of causes, and then we will try to resolve them. And of course, we are here to lead and guide. A lot of things we need to do it together, and eventually, hopefully, everything will go smoothly for you guys. Yeah, thank you.
Yeah, I agree with everything that you said, Krish. Is very comprehensive, and I just want to summarize a little bit. So there is the physical. So because your partner is older, so maybe a checkup might be in order. The next one is to look at whether it's psychological. The next one is because of aging. There are also the possibility that there needs to be some training around their sexuality. So we actually teach exercises to help people to develop more confidence around their erection. So it's more around the organic way. So things like pelvic floor squeezes can help, and being more in touch with your body. So general health practices definitely will help with health. Such as getting enough sleep, getting enough exercise, getting looking into your diet, your lifestyle, smoking, all these things helps. Okay, so it's kind of like do what you can, but don't just do what you can. You may actually be barking up the wrong tree, right? You may be barking up the wrong tree. So why not get a full consultation first, physical. Once the physical is ruled out, then you go for the mental, psychological, and also the behavioral approach, which we cover. So I remember many years ago, I had a client. They came to me, and then I taught them this, that exercise, and then months later, the wife wrote to me and said, "Mata, you didn't tell us that my husband should go for a checkup." So he got tested, and his issue was low testosterone. So actually it should always be you do the physical, then you go for the therapy. But who is to say you will not benefit from also going for the consult and also doing both of them concurrently? Because I know our clients who they are very eager to solve this as soon as possible. So it's really, really okay. And this is your life, this is your choice. We are here to support you. So I hope we have given you some food for thought about different topics around sexuality. So next month we will do another Ask Us Anything. And then after that, we will decide whether we want to maybe take a break from doing it or maybe do things in a slightly different way, because we actually have many workshops coming up. So most of them are actually listed under my other company called Eros Coaching. So check it out. That's eroscoaching.com under events. Okay, /events. So eroscoaching.com /events. But if you want to book a session with Krish or Shaza, the other counselor that we have, then you can actually go and book the free 15-minute chat. Okay, just to let us have an idea what is your issue, have a sense of the, the rapport, and then whether you want to commit to sessions with us. So I want to say, actually, Krish has a workshop coming up soon, next week, right? So maybe you can tell us a little bit about your workshop.
Yeah. This workshop is aligned with the Pink Dot we call Pink Fest. Okay, my workshop is on gender affirming sexuality workshop. Is looking into how can we feel better even we are under the so-called gender diverse or diversity, not in the mainstream. So I think there's something that for us to look into, and I will have a special guest will come in to join me. Of course, Dr. Mata will be the host as well. So do join us. It will be on 25th June, Tuesday, 7:30 p.m. online. Yeah.
Oh, okay. So not next week, the week after.
Yeah.
Yeah, week
25th.
after. Yeah, okay. So this Saturday, Shireen, another counselor, she's going to run a session in the evening, so a bit late for the parents. You know, they want to put their kids to sleep. That's why we chose a slightly later hour. So anyway, we are doing a sex positive parenting, okay, for all parents. And that's this Saturday. So yeah, there are too many events for me to list out all of them. Go and check out our website, Eros Coaching /events. And once again, remember you can always book a 15-minute Zoom session with us. This is something very special that we are offering because for 15 years I didn't offer it. It was just very distressing for me for people to book and then just don't show up. So this is something that we hope people will not abuse and genuinely book because you want to get support and you want to see whether there's this rapport with the counselor that you're interested to hire. So we need to end. It's already the top of the hour. So I want to thank Krish for coming. And
Thank you.
the next one will be next month. So so stay tuned and look for our event announcement.
Thank you.
Oh, if you found,
Bye.
yeah. Oh, yeah, bye. And also, if you found this video useful, please share it with people that you know. Yeah, a lot of times people watch the recording afterwards, right? So if you found this useful, maybe there are certain scenarios that can help some of your friends, share it with them because that can be your indirect way of supporting them. Maybe they are still not realizing that there are counselors like us who exist and that we have actually very tangible skills and exercises that we can teach our clients to support them so that they get better and stronger and have happier lives. Yeah. Okay. So thank you everybody for coming.
Bye.
Bye.